Hello YouTube family, it's Stephanie, the Thrifty Mom, coming back with you and to talk to you a little bit about what happened today at the oral surgeon consultation today. So let's just dive right on it and I'll explain to you exactly what happened. So I arrived there. I have notes. So I arrived there at 12. My appointment was at 12:15. So of course I went in there and then I did everything online, like to fill out the patient forms and stuff. So I go in, I give them my insurance card, both my dental cards, my ID, and they said go have a seat. We're putting it all on the computer, blah, 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 blah. So I go have a seat. And remind you, I have insurance. I got 2 different insurances. So they call my name up. I go up there to the counter, and they said, well, you owe a consultation fee of $116. I told them that my insurance should cover that. And when I talked to my insurance yesterday, which I called them about 3 p.m., and they told me that for the oral consultation that the insurance would pay 80% and that I would pay the 20%. She told me, no, my insurance does not cover that. So we'll get on into more about that in a little bit. So I went ahead and paid the $116. $116. So then I went back and sat down, and then I waited for them to call my name to go back in and have my oral consultation. So I sat there about 10-15 minutes, and they finally called me to head on back. So I head on back. Of course, they told me to go ahead and take a seat, and I had my tablet and I had a pen too. And she's kind of looking at me, and she's like, well, what's that for? I said, I'm old school, and I like to take notes and write down everything that's going on when I'm in and when I go to an appointment. She's like, oh, okay. So she asked me, like, if I take any medications and if I prescribed any medications. I said, no, I don't take nothing. Then asked me if I smoked, asked me if I drank, like the normal questions they ask you. Of course, everything was no, 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 no. And she said, well, do you take anything over the counter? I said, yeah, I take Excedrin migraine medicine. I said, because I get migraine headaches. She's like, oh, okay. She's like, well, so she started writing all that stuff down. So after she did all that, she persisted in saying, well, do you have the referral? Which I give them the referral in my x-rays from my primary dentist. So they're in there looking around at my teeth, and they're counting, you know, da-da-da-da-da. And she's like, well, I see you need 20 teeth pulled. I said, yeah, I do. And so she also was checking, I don't know if you can see, but under here, there's two big knots. So she told me that, like, when I go in for surgery, that they would have to, like, smooth those knots down. Because, like, after they pull my teeth and stuff, that way the dentures would fit better. Okay, so, okay, let's see what else. I got so many notes here wrote down. And, so they checked my teeth. They seen the bumps on it. They said they would have to smooth them down. And that when I would go in to have surgery, they would put me on anesthesia, which is local, but kind of like in twilight, to help me relax and kind of like drift off, but not like totally asleep. And then she said that there would be some stitches on top and bottom. She said in the piece that's up here on the top, that little dangly thing, they would have to cut that across, and that would also need to be stitches. She said there's like 4 or 5 teeth that they can pull like really good. Other ones like that and that, there's a couple that they would have to go in the gum line and cut my gum to get the teeth out. So they said there would be stitches on top and bottom, but they will be disposable stitches or dissolvable stitches, so they will dissolve after that. She told me that the procedure would take anywhere between 40 minutes to an hour, and that it would take 4 to 6 weeks for my gums to heal, and that I would have to have a driver be there with me to drive me home. Okay, and then she took my blood pressure. So anytime I go to the dentist, my anxiety shoots up. So when I know my blood pressure is going to go up. So they took my blood pressure. My blood pressure was 161/104. Okay, it's getting better. Okay. So this is what needs to be done. 20 teeth need to be pulled. I'm going to be on a local anesthesia with sedation. She said also take several days off of work to recover. There will be swelling, bruising, and I may feel nauseous or I could vomit. Okay. Now she told me that I needed money up front to get my teeth pulled. Okay. But I also have to call my PCP to make an appointment to have an EKG done. So I have a paper that I have to. So it's a process. So it's pretty much a medical clearance request form that I have to take to my doctor. They need a complete medical history and physical examination, a complete medication if the patient is taking anything, a EKG. So this is pretty much like a pre-authorization thing that my doctor needs to fill out before they'll go and have surgery, do any surgery. So there's that. So there's another appointment that I have to make to my PCP, and they'll probably make an appointment to go get an EKG done. Okay. Oh, just let me tell you some more. So then she was talking about dental implants. I said, no, there is not going to be no dental implants because I can't afford them. So there's that. And of course, they gave me the pamphlet about anesthesiology, so got that. Okay. So, I asked the lady, I said, how much does it cost to get one tooth pulled? She told me $350.50. That's if you don't have insurance. And then I asked her, how much does it cost for the anesthesiology? She told me $785. Well, by then, like, these prices just keep going up and up and up and up. Well, apparently, my dental insurance only covers $1,000 per calendar year. Okay? Per calendar year. That's it. So she told me the total price, this is just getting teeth pulled, stitches, and anesthesia. She told me the estimated cost, I have all this, $5,460. That's when I about hit the floor. And I started going into full-blown panic attack. Getting very upset over this because I've lived with bad teeth for a long, long time. And I thought that with me having dental insurance, my husband's dental insurance would cover the majority of it. No, no, no. They won't even accept my husband's dental insurance. They will only accept mine because I'm the primary. So they only took mine. So Let's see what else. But she told, okay, so after the fact of all that, she told me what I need to do, da-da-da. I said, listen here, I don't have $5,460. Don't have it. So they said, well, try the credit care. Try the credit care. Well, guess what? I can't get approved of that either. So here I am in a dilemma. Very upset. I was upset earlier, but I calmed my ass down. So, that's what I'm dealing with. So I have to have money up front before they pull my teeth. I got to call my PCP, make an appointment for the EKG. Then I'll have to, after I get all that done, and then my PCP sends the paperwork back to the oral surgeon. They'll call me up and let me know they received it. Then I can call and make an appointment to set up to get these teeth pulled. But she said, make sure you have money in hand. Is there anything else I wrote down? I think I covered pretty much the gist of it. I'm literally devastated. Like, I don't know what to do at this point. And that's the receipt where I paid. So, that's the update. I don't know what I'm going to do, how I'm going to come up with $5,460 to get my teeth removed. That's only removing them. And then, of course, then you got to come up with money for dentures. And I told the lady there, like, I got very upset in the office, and I told her, you know, I bust my ass every day. I work every day. I'm paying for dental insurance. And I said, and it don't cover shit. And I said, and people that's out on welfare can come right in off the streets, walk right through that door, and get every goddamn tooth pulled. I'm sorry, but I was heated. And she says, I get it. I said, but it's just ridiculous that it costs so much money. And I'm just like beyond myself. Because I put off for so long to get my teeth done, and now to the point that they have to be removed. I don't know what to do. It's hard. And when your teeth cause you so much pain and you can hardly eat anything. But anyway, enough with that. But I just wanted to give you an update and let you know where we're at right now. As far as right now, it might be a while before I can get back into the dentist, because there's no way that I don't have that type of money to come up to get my teeth done. So, but I think I might call around at different places and just maybe get a quote and see what other dentist offers. And oh yeah, she did tell me, because I asked, I said, well, I already told you this. I said, how much? Yeah, I did tell you that about the tooth. $350.50. Now, I think that's a little bit crazy to have one tooth pulled, $350.50. And the anesthesia, $785 for only being put out for between 45 minutes to an hour. That's highway robbery. I don't care. Like, I think they was just trying to jip me or something. I don't know. So I called my insurance company when I got back to the house. What time? Yeah, I called them today. Yeah, I called them today when I got home. And I said, I just have a few questions for you. Maybe you can help me. And I asked her about the oral surgeon consultation. I said, does my insurance pay for that? She said, well, let me look. So she looked, she said, yeah, the insurance pays 80% and I would pay 20%. Well, the lady at the counter, she says, no, your insurance does not pay for oral consultation. So I paid it. And the lady from the insurance company said today, no, 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 no. She says, we pay 80%, you pay 20%. She told me that, because I have my receipt. She said, send your receipt to us in the mail. She says, make a copy and keep a copy for yourself. Send the original receipt in the mail, and we will reimburse you that money back to you. She said, She's like, they're in your network. They should not charge you the full price. The insurance, that's why you have insurance. So, that's what's going on. That's what's going on. So, this journey is it's going to take a while. But I'll keep everybody updated and posted and let you know, like, what's going on with my teeth. Of course, they're so sore up through here. It's just awful, and I can't stand them anymore. It's embarrassing. So if you and all could send prayers, I'd appreciate it. And if you like this content, subscribe to my channel. Become part of my family. And I will see you on the flip side, and I'll talk to you later, my friends. Bye.